Hey, what's up, guys? It's me, ThePsychNPDavidC. Are you trying to figure out whether your next psych appointment should be in person or telehealth? In this video, I'm going to help you decide based on your needs, lifestyle, and comfort. We'll go over things like the convenience of each one, the difference in building rapport with your provider, and other small things such as the need for lab draws or overall safety. Let's talk about it. So let's start off by describing what a typical psych appointment looks like. A lot of it is just medication management, which means your provider is deciding if you need any medication adjustments. Sometimes they want to check your labs, so they'll order a blood draw for you. And then they just check overall for any symptoms or side effects. There can be some situations where you absolutely need to go in person, such as getting your blood drawn for labs, or maybe you're going through a crisis. But for the most part, most psychiatric appointments can be done either in person or telehealth. So let's discuss a few reasons why in-person might be better for you. First of all, you get a stronger overall connection with your provider. I mean, it seems pretty obvious, but if you're meeting somebody face-to-face in person, you're going to have naturally a stronger connection with them than a provider that you're only seeing through a little screen. So if that's something you value, you probably should go in person. Another reason is if you need immediate lab draws or injections. There are some medications that require regular blood draws like Depakote or lithium. So if you anticipate that you're going to need a blood draw that day, you should probably just go in person. And then there's also some medications that come in injection form, and some places only allow the provider to administer it to you in person. Generally, most injections in psych are antipsychotics, so this is probably not going to apply to most people. And there are some medications for substance abuse that are injectable too. And last but not least, going in person makes it for a more structured session. Like, you're most likely going to be pulled into a room, so you're talking one-on-one privately with your provider. There's going to be less distractions. It's going to be a more focused session, since it's basically just you guys in one room. Now let's discuss some reasons why in-person might be less ideal for you. One big reason is commuting. Let's say your clinic is like 30 minutes away from your house. That's an extra hour you have to invest each day because you've got to drive there for 30 minutes and then drive back 30 minutes. And then some places have really bad parking too, so you got to spend time trying to find a parking spot. And then there's also scheduling challenges. Like, let's say your clinic is only open 9 a.m. to 5 p.m., but that's also the time that you're working. So if you wanted to go in person, you probably have to take like a day off or something. And for people with mobility limitations, like somebody in a wheelchair, it's a lot less convenient to go in person too. And then there's also the challenge of anxiety and depression. Maybe you just don't want to go outside. There's also more potential exposure to contagious illnesses. Like, you might be sitting in a lobby full of people and like somebody next to you starts coughing and sneezing, and then you're kind of just like stuck there in your chair. And then the next day you end up having a cold or something. And then there's just some people who feel less comfortable sharing personal information in the clinic. Because like when you're checking into a clinic lobby, there's most likely other people around you, so they're gonna hear like what you're saying to the receptionist. Okay, so now let's discuss why telehealth might be better for you. If you're an introvert who doesn't really want to be around people, telehealth is probably better for you. This is actually one of the reasons why I didn't see a psych provider for the first time for a long time. Like, I wanted to see one for like potential depression, but I never wanted to go in person because I don't like being around people. So once I found that there's a telehealth option where I don't have to go anywhere and I just log in on my phone, that was actually the first time I saw my psych provider. And then there's also the convenience in commuting and flexible scheduling. You don't have to drive anywhere, you don't have to find parking. It'll be a lot easier to fit the appointment into your schedule since it's telehealth. Like, I've even had a lot of patients talk to me while they're like outside in the park or something. And it's better if you have like transportation challenges or mobility issues like we discussed earlier. Overall, the level of comfort is probably higher for most people. They'd probably feel safer opening up at home instead of in a clinic. If you already have a psych provider and your follow-up appointments are like 2 minutes or 5 minutes, telehealth is probably easier. Like, maybe you just need a refill and you don't need any medication adjustments. And you get less exposure to potential illnesses, so that's more safe. Now let's get into why telehealth might be less ideal for you. You're gonna get limited physical observation, like you can't see the other person's body movements or body language. Like, let's pretend I'm your provider and we're doing a telehealth session right now. Like, you can't see my legs, so what if my legs are like shaking uncontrollably? Yeah, this part is probably more important for the provider, but it's still something to consider. If you know you need lab draws, you're gonna have to go in person. And then having technical difficulties is actually a pretty big one, especially if you're not very tech savvy. You know, there's been a lot of times where a patient said they can't log into the link, so I have to message my office assistant saying they can't get into the link, and then I have to wait around until they can fix it. If you don't have reliable internet, telehealth is probably bad for you too. I've had patients with really bad internet connections where they just like stutter and buffer the whole time, so I can barely even hear what they're saying. And then there's always the occasional camera or microphone issues. So if you're not tech savvy and you don't really want to deal with that, then telehealth is probably not for you. you. Also, if you're concerned about your privacy at home, telehealth is probably less ideal for you too. Like, you might not be able to get in a private space where you can relay your concerns to your provider, whereas in person, you get like a private area one-on-one. Now let's get into some general questions you need to ask yourself just to help you decide. Number 1, how comfortable are you opening up from home? Number 2, do I need any labs or injections soon? Number 3, is my internet reliable? Number 4, do you prefer the face-to-face rapport, or do you value the convenience of being at home? And number 5, are you at risk for crises or complex symptoms that require in-person attention? So after you make your decision, here are some general tips that will help you with your appointment. For in-person, planning your travel ahead of time will help you a lot and save you a lot of time. Bring a list of questions you want to ask your provider, because like once you're out of the room, you're probably not going to talk to them again for a couple weeks. And if you're just anxious about in-person visits or like being outside, just remember to use any kind of calming techniques that help you. And then some tips for telehealth: make sure you're in a private, quiet room. And for this one, you should bring a list of questions too. If you're worried you might not be able to hear your provider as clearly, you could use headphones for better audio. And if you feel like telehealth isn't working for you, just be honest with your provider and ask for an in-person visit next time. So to recap, in-person visits are best for just like labs, complex symptoms, or building connections, while telehealth is best for just like convenience and accessibility. One is not strictly better than the other, it really just depends on your needs and your preferences. So which one do you prefer and why? Let me know in the comments down below. If you found this video helpful, make sure to like and subscribe. I am also on TikTok and Instagram if you want to follow me over there at ThePsychNPDavidC. And with that, your mental health just leveled up. Welcome.